We have had a lot of questions about calories and what you should eat to lose weight. In this video, I will explain to you how important calories are to help you lose weight. I will also explain why calories are so different for each person. At the end, I'm going to give you the golden ratio of what to eat for weight loss. So how many calories should you be eating? Well, so individualized for each person. So just today, I had 2 patients come in, but I'm actually going to give you 3 examples. One, the lady was 60, and she has lost maybe 6 pounds since February. And she was just like, I'm trying to eat, I'm getting this many calories. And then, so I actually said, okay, if you think you're getting that many calories, she said about 1,200. I said, let's break down. What did you eat yesterday? So in the morning, she had 2 eggs, piece of toast. Lunch, she had a salad with salmon, big piece of salmon, she said. And then dinner, she was busy, so she had a protein shake with 30 grams of protein. So if you actually add that up, she was maybe getting 800 calories. That's why she's not losing. 1, she's not getting enough protein. 2, she's not getting enough calories. Body goes into a state of starvation and you won't lose. Then I had the second lady come in, and she's in her 50s and she's not losing. She's been on it for 2 months and she has only lost about 6 pounds. Now the average is, anywhere from 8 to 12, maybe 10 to 15 a month. So again, I asked her, how many calories are you eating? And she said 1,500. So I went through and I looked at her BMR, and she should be getting about 1,504 calories a day. So if you actually think about that, she's not going to lose. She's at that BMR is your to maintain weight. So she needs to eat 200 to 300 calories less than what that said. So she needs to be eating right around that 12, maybe 1,300 calories. A lot of people have said, well, that's too low. But when you look at the metabolic age and you look at the metabolic rate, then that is not too low for her age and her rate. But we don't want her less than 1,200. And then as she starts exercising, she loses that weight. We need to readjust that. We need to look at that. So for instance, myself, when I started this, my metabolic age was 90. Now I'm at 54, and I'm actually 50 years old. So what it's telling me, everything changes. So that's why weekly when people come in, we are getting this BMR. We're looking at their muscle composition, their fat, their water, trying to make sure that everything is going the way that it should. So I had to adjust that. But if I ate more than 1,200 at any point, I gain. My individual BMR is 1,400. It's stayed pretty consistent for the last 2 years. We have had hundreds of people on this, hundreds. I am a nurse practitioner, so I look at all of the research. I look at all of the numbers. Yes, it sounds low, but it actually is so individualized, and that's what is very important, is to find out what's appropriate for you. And remember, I told you that it's so different for each individual. Each individual has their own caloric intake to help them lose weight, gain weight, any of that. So it is very important. So the first lady, she should have been eating probably, 1,300 calories a day. The second lady, kind of the same thing, 1,300 calories. That's why the BMR is really kind of important, because it gives you that idea based off your muscle, your fat, your bones, water retention. It's going to explain to you why you need to have that certain calories. It is not one person fits all. It's definitely not that. It's each individual. Myself, yes, if I eat over 1,200 calories, then I'm going to gain. And it sucks because my metabolic age is so bad. And I'm working out and I'm eating right, trying to get the protein. But it is really important to know what's best for you. And that's why it's so individualized. Now, the golden ratio, I want to explain to you how and what you should be eating. It's simple. Protein, 75% of your meal. Complex carbs, 25% of your meal. I use a dinner, or most people do a dinner size plate. You want a saucer size plate. 75% protein, 25% complex carbs. Simple. Since you made it to the end of this video, I know you like the content. Subscribe for more.